I'm not the type of person who likes to expose themselves as far as political opinions and nursing opinions. So currently, you're seeing the view from my porch, so I can explain my opinions on the current situations going on. Um, I personally do not take care of COVID patients because I do take medications to make me immunocompromised. So the risk versus benefits of making me take care of patients is outweighs any risk I'm willing to take. And luckily, I work at an organization that supports me on that. However, I've been watching the news and talking to my friends and fellow nurses that do take care of COVID patients, and their viewpoints differ from mine. I am not big on wearing a mask, however, I should be, specifically in the complications I have with my own medical health. And this weekend, I finally saw, or they expressed some of their feelings about how they're upset that other people aren't wearing masks, and it made me come to the realization that I had a wrong viewpoint. They have seen patients die, patients sick as you could ever imagine, going through the worst, and they are the ones having to wear the N95, the face shields, glasses, gowns, dealing in the exhausting heat of a hospital, although most hospitals are known to be cold, but when you're wearing all that gear, it's hot. You're in a loud environment with the air system going, and it just takes a toll on you. I can only imagine for the nurses that take care of them. However, I work at a surgical ICU, specifically dealing with open heart surgeries and neurosurgery patients that are sick as well. And so every patient that comes in our unit is tested for COVID. And they have to be negative basically in order to come to our unit, because at this moment our corporation cannot sacrifice having our ICU closed again. But they also require us to wear level 3 mask when we're in a non-isolation room. For example, they're not getting aerosolized treatments or high-flow nasal cannula BiPAP ventilators. When we are in patients' rooms that have ventilators, BiPAP, high-flow oxygen, aerosol, nebulizer treatments, we're required to wear an N95 mask. In every patient's room, we're required to wear a face shield. And this is a big device that basically screws onto your head, and we tried to wear surgical caps to help from this putting pressure on our faces and our head from destroying our hair, which is a girl thing, I'm sure, but as well as the males that did have hair, they also had to shave their beards, which I give them credit for, because I definitely was not cutting my hair to fit into the acceptable range of what's required to wear N95. But basically, it is taking a mental toll that I don't think is addressed in healthcare, that not only taking care of these patients is exhausting in the fact that they're sick, but also exhausting in the fact that we have to wear all of this protective equipment, specifically with COVID patients, but I myself feel it as a patient that takes care of as a nurse that takes care of patients that are non-COVID patients. I have to wear this gear while doing compressions or CPR on a patient that's dying, and I don't want to brag, I literally can do the compressions for a long time without this isolation gear on. But when I have to wear it in that situation, I get tired in 30 seconds, where I could do compressions for 5 minutes. Let's be realistic, probably like 2 to 5 minutes with no isolation gear. my brain doesn't think appropriately. I feel like my CO2 level is building up when I wear these masks through the day. I feel claustrophobic. I feel like I can't breathe. My anxiety's high. And it's a stressful environment. And I'm not even a nurse that has to deal with COVID patients. So basically, I just wanted to personally express my concern not only for physically for nurses, but mentally, that COVID is taking a toll on the nurses, not only those who take care of COVID patients, which I feel so much sympathy and just I want to hug them, because I can't even imagine taking care of the patients and dealing with that environment. But also as a regular ICU nurse that takes care of surgical patients, that I also feel the toll it's taking, that patients are coming in sicker because they don't seek medical help. We're being stressed and stretched as far as we possibly can across the hospital because we can't have travelers, because we're trying to save money for our stockholders, and it's just a much more stressful environment than I've ever realized in my life. And I don't know that we've experienced this type of stress since World War II, the Spanish influenza. I mean, even Vietnam soldiers, I feel, our medics, I feel like we're the last people to experience this type of stress. You can also include Afghanistan, Iraq soldiers in that environment will trigger eventually some type or form of PTSD between patients, nurses, doctors, respiratory therapists, EVS, the cafeteria personnel, the general public that works in areas, food production, anywhere that basically is affected and they're losing their jobs. I feel like there's minimal solutions, and the solutions there are, such as vaccines, I question, because it takes so long usually to approve vaccines and ensure there's not further complications from those. But as a nurse, I am lost on how to feel about the situation besides sorrow, and empathy, compassionate, everything that I could possibly strenuate as a nurse or feel, or whatever wording you want to use. But basically, this is probably the toughest thing that myself and other nurses will ever face in their career. I think we're handling it excellent as we can. I feel like the government is just trying to do their best, but they have no idea what the front lines are like. I feel like the corporation, CEOs, upper management does not fully understand what we feel. I feel like they're trying to support us, but they just don't know how, because this is something we've never faced as a population, or an economy, or anything in general, with the exception of the dogs. They kind of keep you sane and knowing something is important in this life. But I really hope you just support your medical, your everyday people all around, because this is not easy for any person in this world to survive.